Imagine going in for a routine teeth cleaning and coming out with loose teeth and bleeding gums. For some people, this is the harsh reality of improper tartar cleaning. So today I will be honest with you about teeth cleaning issues caused by the dentist and also what is considered a misunderstanding. Hello everyone, what's up? I'm Dr. Ibrahim. I'm dentist helping you take care of your mouth. I received a lot of comments about the problems that result from teeth cleaning at the dental office. For example, someone might say, my teeth were fine, but when I went to get them cleaned, the dentist drilled them really hard and created gaps. I never had gaps between my teeth before. Or someone else might say, since I had my teeth cleaned, every time I drink cold water, they hurt a lot and my teeth are very sensitive. Or a third person might say, my teeth were stable and perfect, but after cleaning the tartar, they became loose and I feel like they're going to fall out. I felt like the dentist was really pulling on them when he was removing the tartar. And there are other things like tartar cleaning breaks teeth and tartar cleaning weakens teeth. Is this true or false? If it's false, what is the correct explanation? Let's talk about this point by point. First, when someone says, I went to a dentist for a cleaning and now there are gaps between my teeth that weren't there before. Does tartar cleaning actually create gaps? The answer is, there are two possibilities. First, the dentist used the wrong instrument to remove the tartar, which can cause problems like gaps, sensitivity, and yellowing of the teeth. If the dentist used the wrong instrument called a contra or handpiece or drill during the cleaning, and he did not use a suitable instrument, which is called an ultrasonic scaler, the difference between the two is that the first instrument is used to remove cavities, make fillings, and do other things that require drilling into the teeth, other than removing tartar and teeth deposits. It should never be used to remove tartar. And actually, it is very rare that dentists still do this today. The second instrument, much ultrasonic scaler, works by emitting very small and rapid vibrations. As soon as it hits the surface of the tooth, it removes the tartar from the surface of the teeth. So, gaps are rarely caused by using the wrong instrument to remove tartar. The second possibility is, when is this a misconception? There are two cases. The first is that the most common place for tartar to build up is between the lower front teeth on the inside surface. Over time, it builds up layer upon layer as the gums recede and go down, and it increases in size. Here, the dentist comes in to remove the tartar layers, and then you immediately feel with your tongue from the inside that something has changed and that there are gaps between your teeth. You may even see it with your own eyes later. This is because the tartar itself caused the gum recession, and the recession is what caused the gap between your teeth. You just didn't feel it because the tartar eventually filled in the gap. So when you removed the tartar all at once, you felt the gap immediately. This brings us to the second case where you also feel gaps, but larger ones. This is similar to the first case, but there is a lot of tartar buildup, and the recession has occurred in the gums and the surrounding jawbone. In this case, the teeth are not properly attached to the jawbone because of the recession and erosion caused by the tartar, as we mentioned. Over time, and with the force of the tongue pressing from the inside on the teeth for months or even years, the teeth move and tilt outward. This is called proclination. There is still tartar building up that fills in any gaps that appear over time. Of course, the dentist will also remove this all at once. The teeth appear to be very prominent, and there are large gaps between them, and they become very loose. Here again, we know that tartar cleaning itself is not responsible for creating the gaps in the first place. The tartar itself is the cause. This means that we should go to a trusted dentist for a cleaning as soon as possible so that the problems don't get worse over time. Many people might say, so why should I remove the tartar if my teeth will become loose afterward? Why don't I just leave it to hold my teeth together? I would say, you are right, the tartar is holding your teeth together right now, but sure, it will cause gum inflammation, which will cause gum recession and bone loss over time. If you don't remove it, it will take all of your teeth with the tartar when it doesn't hold them in the bone anymore, and they will fall out. It will also cause inflammation, bad breath, and constant bleeding from the gums. So it is best to remove it regularly and not let it build up in the first place. Now, what is the cause of pain and sensitivity after tartar cleaning? The same thing, guys. Either the dentist used the wrong instrument and removed some of the enamel from your teeth, or they used the correct tartar cleaning instrument, the ultrasonic scaler, but they used it incorrectly, which caused you pain and sensitivity. The second reason, and it is a normal cause, is that if there is gum recession, as we mentioned, and we remove the tartar, the roots of the teeth are exposed. The roots of the teeth do not have the enamel layer that the teeth crowns themselves have, and they are very sensitive to anything cold. In general, this sensitivity is temporary and will go away, God willing. You can reduce it by using a mouthwash or toothpaste that contains a high percentage of fluoride. You will find it labeled for sensitive teeth. Or if the pain is severe, the dentist can do a chairside fluoride treatment in the clinic, which will greatly reduce the sensitivity. The third point is when someone says that his teeth moved after cleaning the tartar and became loose because he felt like the dentist was pulling on the tooth really hard and wanted to pull it out. Really, I heard people sometimes say this, and it is a misconception. It happens because in certain cases, when tartar is present under the gums in deep areas, the dentist does something called cleaning using other manual tools called hand scalers, not a machine. And usually, if the tartar is stuck on a bit, you will find the dentist pulling a bit hard with this tool to be able to remove the tartar. Of course, this has nothing to do with loosening and moving your teeth. We said earlier that the loosening is caused by the recession of the gums and bone due to the presence of the tartar itself, as we mentioned. However, the dentist himself, when using these tools, must do so carefully to be able to remove the tartar from these deep areas. The fourth point is, when does tartar cleaning break or weaken teeth? Because many people say this too. Tartar cleaning, guys, does not cause problems as a procedure if done correctly, like anything you do at a dentist or any doctor at all. But if done incorrectly, it can cause a lot of problems and weaken your teeth over time, causing sensitivity and other things. Someone might say, so now, should I clean my tartar or not? Don't confuse me now. The answer, of course, is like any other procedure that you need to clean it. But you need to choose a skilled dentist that you trust, even for a simple procedure like tartar cleaning. Just like I said in other videos about braces, skillings, and other things. You need to choose a skilled dentist that you trust. That's it for today's video. And keep smiling.